My name is Noah, and I've been on testosterone replacement therapy since I was 25 years old and I was diagnosed with hypogonadism. In this video, Dr. Moehle and I discuss all things related to my blood work and my hormone replacement therapy protocol. We go over a lot of the big stuff, but we also get into smaller things and more nuanced things that she is looking at that she thinks are very important to keep an eye on when someone like me, who needs it, is on testosterone replacement therapy in order to be on this protocol safely for the long haul. One of the things you're supposed to do, though, when you're on TRT is get regular blood work. And admittedly, I haven't really done that the last couple years for a variety of reasons. I was really deep in alcohol addiction for a couple years, and I just didn't want to address anything that might put a magnifying glass on poor health. That's a personal issue. But the good news is I've been sober for a few months now, and I'm ready to have a more active role in my overall well-being. And part of that is making sure that my symptom relief, my side effect profile, and my blood work on testosterone replacement therapy, they all are gelling. They all are in a good place.
Okay, should we dive into your blood work?
Yes.
Okay, so starting off with testosterone, this is your total testosterone. You're at about 1100, so you're a little bit above the reference range.
What are your thoughts on reference ranges that have been increasingly getting smaller and lower over the last 10 years?
I don't worry much about the reference range with testosterone. It's more about how you're feeling. Your free testosterone, you're actually at the very top of that free range. And I actually really care about free testosterone more than total testosterone.
Yeah.
Do you know why?
Is the bioavailable testosterone?
Yeah, it's what your body actually has access to. So you can carry around like high levels of testosterone and it'll be bound to proteins. And if you have a low free testosterone, you still can have all of the downsides of having low T. But you're not in that category. So anyway, I don't think we need to make any changes here because it sounds like, based on what you've been telling me, you're feeling really good.
I feel really, really good.
Okay.
Yeah.
Perfect. Okay, thyroid, we just wanted to take a peek at this just to kind of keep tabs on what your overall hormone status is. So this looks fantastic. I mean, are you familiar with how the thyroid hormones work?
So it's been deeply explained to me in the past.
Okay.
I haven't revisited that. If you want to quickly,
we'll recap.
That'd be great.
Okay, so TSH is released from the pituitary gland, and it's the hormone that tells your thyroid gland to make thyroid hormone. So thyroid gland then makes T4 and T3 and a couple of other thyroid hormones that are just less key players. The majority of the hormone getting pumped out of your thyroid gland is free T4. And this goes into your peripheral tissues, and most of our free T3 comes from conversion from free T4. The thyroid releases a little bit of it, but free T3 is the most metabolically active thyroid hormone. So conventionally speaking, a lot of docs will just be testing TSH because the thought is that if TSH is rising, if your pituitary gland is yelling at your thyroid to make thyroid hormone, that's when you might be dealing with hypothyroidism. But I think based on the literature and what we know physiologically about thyroid hormones, what matters a lot more is what your levels of free T4 and free T3 are.
Okay.
So that's what I'm looking at. Yours is 3.6 of a reference range of 2.3 to 4.2, so you're at the upper end of that reference range.
Awesome.
Which is great.
Yeah, and very, very briefly, the thyroid is, its key responsibility is what? Why is it important to keep it in range?
So many things. It plays a role in metabolic health, reducing visceral fat, and also cholesterol metabolism.
Got it.
Lots of other things too, but
like
those
the
are
big key markers.
That's what I think of.
Cool, thank you.
Yeah. Okay, and then your CBC looks good.
What's a CBC?
Complete blood count. We want to keep an eye on your blood counts when we're doing testosterone therapy. Sometimes you'll get increased red blood cells and hematocrit with TRT, and it's not really a problem unless your platelets are getting elevated, because that puts you actually in a hypercoagulable state. And this is a controversial topic, so your viewers are probably going to have thoughts on this, but
well, it's good to have these conversations.
Yeah, absolutely. So having a high red blood cell and a high hematocrit is typical of somebody who lives at high altitude. Do we phlebotomize those people? No.
And when you see phlebotomy, you like drain them?
Yeah, you take blood to bring
make
that
sure it's
count
down.
to bring that red blood cell count
and
down.
Where's my red blood cell count?
It's like smack dab in the middle.
Which is great.
Yep.
That's awesome.
It's fantastic. Your hematocrit is good.
Awesome.
Also, like, high end of the reference range. And you want those things to be at the higher end of that reference range because this is what the red blood cells carry oxygen. They oxygenate your tissues, especially if you're a high-level athlete. Like, you need that.
Yeah.
And then we look at platelets, which is what can create that hypercoagulable state where you're more at risk of throwing a clot. And you're, again, mid-range.
Cool.
Yeah, perfect. So this is like a perfect CBC for anybody, but specifically somebody who's on TRT.
Awesome.
Yeah.
Yeah, I'm really grateful for that.
And the risk with phlebotomizing guys who have a high hematocrit is that you can actually make them anemic if you're doing it too often.
And what is anemia?
Iron deficiency. Well, you can get different types of anemia, but most often due to like high or frequent phlebotomy, it's going to be iron deficient.
Got it.
Because you're just draining your blood cells.
Got it.
Yeah.
Thank you.
Yeah. And this is just a breakdown of your white blood cells here. Everything looks good.
So I wanted to quickly touch on this, and we can make it very brief.
Sure.
But if I'm remembering correct, my white blood cell was a little lower than I think I expected it without having any past medical knowledge to verify this concern. Just based on the reference range, that I was like, oh, this is relatively low. And you said not to worry. And not only that, my dad, who happens to be a doctor, is like, don't worry.
Yeah.
Why would my white blood cell be relatively low on a range, and why is that not something to be concerned with?
I don't have a really good answer for you. Some people just tend to run low.
Okay.
Yeah.
Yeah, what he was saying, and I wonder if you could at least confirm this, is that it'd be more concerning if it was running really, really high.
Correct.
It'd be an indication that I'm fighting something or that I'm having an overactive immune system.
Yep, correct. Or like a blood cell dyscrasia, like a cancer.
Got it.
Yeah.
Okay.
But this looks good.
Cool.
Okay, and then your metabolic panel, this is your liver and kidney function. Fasting glucose is 71. That's very good.
What does that mean?
So that means that when you are waking up in the morning, your glucose is not spiking. So your insulin production is appropriate, and your response to insulin is appropriate.
Awesome.
So it's a problem when we see fasting glucose over 100 or over 99. That's the reference range.
Yeah.
That means that your blood vessels are exposed to high levels of sugar, which is highly inflammatory and can increase risk of atherosclerosis.
Cool.
Yeah,
Thank you.
That's good. I mean, it's pretty low. Do you wake up feeling lightheaded at all? No, you're good. You just
I wake up feeling like a champ.
You're just in really good metabolic health, I think.
Thanks.
Your BUN, this is blood urea nitrogen. It's just barely high. You're probably just a little dehydrated. Most people are in the morning when they go for a fasting blood draw.
Yeah, and it went not that late. However, I waited for a long time once I was there. I don't think I got my blood drawn until noon. So.
Oh, yeah. Probably just a little dehydrated. But everything else on your CMP looks good.
The CMP, is that just comprehensive metabolic panel?
Correct. Yeah. I like to look at your liver enzymes, AST and ALT. ALT is more specific to the liver.
And is it okay?
Yeah, it's great.
And the numbers are?
Your ALT is 29, the range is 7 to 54, AST 31, range is 8 to 48.
Awesome. Yeah. I ordered a liver panel when I was still knee deep in my addiction, when I was drinking every day, 12 to 14 drinks a day.
Yeah.
And I couldn't bring myself to go get tested because I just didn't want to know, and I didn't know if I could stop anyway, and I just got freaked out.
Sure.
So I'm really relieved and glad to know that despite some pretty rampant alcohol abuse the last couple of years, my liver seems to be okay today.
Yeah. Well, the liver is like one of these really incredible organs that has a lot of potential to regenerate. Yeah. So as long as you give it the opportunity to do so,
it'll do it.
It'll do it.
It's not damaged already.
Yeah, assuming that you're not in like cirrhosis.
Right.
But if you're on that spectrum of fatty liver even, which is where the body starts kind of collecting fat around the liver.
We call that visceral fat? No.
That is a type of visceral fat. Yeah. And it's really common for people who are dealing with obesity, metabolic issues, diabetes, things like that, to have fatty liver developing. But
okay, thank you. I'm glad to hear that.
Yeah, me too. All right, lipid panel. So this is where things get a little interesting. Your total cholesterol is flagged as high. It's 268, and we really want that below 200. Your triglycerides are 48. That's awesome. You can think about triglycerides kind of like sugar on the way to being a fat.
Sugar on the way to being a fat. I've never heard that before.
Yeah.
Cool.
It's an oversimplification, but
Oversimplification is really good.
But generally speaking, that's what it is.
Yeah.
HDL, this is the quote-unquote good cholesterol, also a gross oversimplification, but the HDL kind of deals with reverse cholesterol transport. It takes cholesterol from the body, dumps it in the liver so it can get processed. Yours is great.
So
58.
So my triglycerides and my HDL seem fine. Is it the
Yep.
LDL that's way out of control?
Yep, it's the LDL that's above. It's about 100 points above what we really want it to be.
And what is LDL exactly?
LDL is it's the low density lipoprotein. It's the more atherogenic form of cholesterol.
What does atherogenic mean?
More at risk of causing a plaque in your blood vessel.
Why is it so high, do you think?
I don't know. There's a lot of different reasons. Because you're so healthy, I tend to think that this is probably genetic, which it is for a lot of people.
So what do I do?
Well, that's a good question. So this is not a comprehensive lipid panel. We cannot get all of the information we want just from a basic lipid panel
I see.
anymore. That used to be kind of the way that we did things, but now we understand that we need to look at this other marker, apolipoprotein B, which is a marker on the LDL. And we can kind of think of that as telling us how sticky that LDL is. So how likely is that LDL particle to adhere to the blood vessel lining and start creating a plaque? So yours is 123, which is in the reference range, but because of the high LDL, I'd really like that to be below 80.
Okay.
Yeah. And there are a few things that we can do for this. I personally wouldn't recommend jumping to something like a statin
I don't want to do that at all.
At this point.
Yeah, I would really like to avoid that, if not almost insist that we do.
Yeah, absolutely.
Without being militant, but I've just heard nothing but bad things about that long term.
Yeah, it's probably the most controversial medication out there.
Yeah.
There's definitely a time and a place for a statin.
Sure.
It's not right now
Yeah.
for you. So we'll do some more lifestyle stuff. We could consider starting something called red yeast rice.
Okay.
It's kind of like a natural statin.
Sure.
It's pretty effective in lowering LDL and ApoB. It's one of those things that we could try for 6 weeks, test your lipids again, and see if you're making progress. If not, we'll stop it and try something else.
I'm assuming because it's a natural product, the side effects would be far less notable.
Yeah. A small subset of people will report muscle soreness similar to a statin.
That would be very hard for me to determine.
Yeah, right.
Yeah.
But most people tolerate it really, really well. Cool. So we'll just give that a try. I like to just do 6 weeks because there's no point in you taking a supplement, spending the money and resources on something that's not working.
Yeah.
So that's kind of...
Any other lifestyle things that are obvious beyond...
I think you're doing it all already.
Okay.
Yeah. The exercise is a huge deal. Okay, we finished that page. Okay, your hemoglobin A1C, this is basically an average of what your glucose is running over 3 months. You want it to be below 5.7 to have a normal value. Yours is 5.4, so you're doing good there.
Cool.
DHEA, this is an adrenal hormone, and it actually can be converted into testosterone as well. You obviously don't need testosterone, but the body does other things with DHEA, and it can help support mood and things like that too. So I think that it might be worth starting you on a
DHEA supplement?
Yeah, just like a 25 milligram, I think.
Sounds good.
Because you're pretty mid-range here. And we'll just see how you feel with it.
Okay.
Okay. Estradiol, you're at 40. The range is 0 to 40. I think that's great. Estradiol is also a male hormone, and it's really important in cardiovascular health.
I think that's something that's not widely talked about. I know we're short on time, but can you very, very briefly explain why it's important?
Yeah, sure. I mean, estradiol plays a really big role in increasing the elasticity of blood vessels. And it also plays a role in signaling in the hypothalamus for your pituitary gland to release LH and FSH, which is what goes to the testes to indicate that we want production of semen and testosterone.
Okay.
So, yeah, it's just, it just
So being at the top of the range is not inherently bad, because there's a lot of misnomers online. I've been hearing them for years.
People are like, you need to take aromatase.
Exactly, because if it's even at the top of the range, you're going to
get gynecomastia.
Right, and the mood's you're gonna be emotional.
Yeah.
As if, and they label that in such a strange way, as if having emotion is bad. But
well, you know what actually causes the most emotional lability
low
in men?
estrogen?
Low T.
Sure. Of course.
Yeah.
Yeah, well said.
Yeah.
I mean, I can attest to that from my own personal experience. I was wildly emotional.
Yeah.
And in despair and in fluctuations in mood. So
yeah, it makes a huge difference. So if you're feeling good and you're not having symptoms, I would say let's keep you at the upper end of that reference range.
Yeah.
It's good for your blood vessels. It's good for your brain. All right, and then homocysteine, this is a marker of methylation. So if you're not methylating your B vitamins well, this number is going to creep up. It's also a risk factor for cardiovascular disease if it's high. So I always like to check it just to make sure that you're methylating well. I want it to be below 10, you're 9.7.
So right there.
Yep, you're looking good.
Okay.
And then this is the tissue transglutaminase, IgA. This is just a test to work you up for celiac to make sure that we weren't dealing with that with your gut issues.
Yeah.
No. And we talked about free T3, IgA, that was also part of the celiac. ApoB, we talked about that. Amylase, this is a marker of pancreatic function. It's a pancreatic enzyme. We tested that because we just wanted to make sure that we weren't dealing with like a low-grade pancreatitis or something like that.
Right.
And it doesn't look like it.
Great for that. Or grateful, rather.
And then B12, you're supplementing with B12, right? Oh, you're not. Okay, so you're not bad, but you're not at the very upper end of that reference range, which I like because B12 is so important in so many different cellular functions.
Okay.
Important for mood, energy, that kind of thing. And then ferritin, this is our iron stores. So this is where your body, you take in iron through supplements, food, wherever you're getting your iron. It's mostly like red meat animal products, and your body stores it as ferritin. It's also an acute phase reactant, so if you're dealing with high levels of inflammation in your body, it'll go really high. So if I ever see that flagged as high, I'm like, oh, that person is really inflamed. You're not. You're at 89. The range is 22 to 322. But I think that we could improve that number a little bit.
How would I do that?
Eating more meat.
Really?
Yeah. How much red meat do you eat?
Red meat?
Yeah.
Oh, maybe 5 ounces a day, 4 or 5 ounces a day.
Oh, really? Okay. I don't really want you to eat more than that.
Yeah, I like it. I think it's kind of perfect for where I'm at.
Yeah.
Yeah, it's always grass-fed, grass-finished, or mostly always grass-fed, grass-finished, but I'd say about 4 ounces a day.
Okay, we'll just not worry about the ferritin. We'll keep an eye on it.
Cool.
If we want to get really crazy at the next visit, we can look at your actual iron profile and make sure that you're looking good there. But I think that your nutrition is probably...
I think it's better than most, that's for sure. But it's there's always room for improvement. Real quick, why did you think instantly, oh, I don't want more than 4 ounces of red meat?
Because of the cholesterol. Yeah. Yeah, saturated fat in red meat can drive increased cholesterol for some folks.
LDL? I'm learning.
Yeah.
I'm just kidding.
Like circling back to the TRT, I think you're doing so well with this dose and this route of administration. We don't need to mess with anything.
Awesome.
So as long as you're good with continuing the injections.
I'm good with it. My only thing I wanted to be sure was going correctly or was appropriate. I word this. I wanted to make sure I was doing what was best for my health and not be overly attached to what was going on because I'm afraid of anything changing.
Sure.
Truthfully, being on TRT, there's like I was so sick before I found it that I get afraid of anything changing with it because it was so bad before I found it. Yeah. So I wanted to basically meet with you for a number of reasons, but one of which was an accountability partner for you to look at what was going on and help me be objective about my treatment and make sure that I was doing the best possible thing, because I do have an old school mentality which has gotten better, where it's like, well, a little more would probably make me feel a little bit better. And I understand that's not the case. I started at 200, it got down to like 120, 140, and 160 seemed to be where I land and where I stuck, and I feel really good. But I wanted to be open to you saying, hey, I think you would be healthier and feel better at 20 milligrams less or something. I didn't want to be
you don't want to be dogmatic about it.
Not at all. I want to do what the best possible thing is for my actual health. So I'm just relieved that I don't have to change anything right now because I have been feeling so good. That was one of the main things I wanted to do. I didn't go get blood work for a couple of years because I was so sick and unhealthy in my addiction. I didn't want anything else to change. I didn't want to look at myself in the mirror. I didn't want to be held accountable. So, yeah.
Well, I think you're doing a great job right now.
I'm trying.
Yeah,
I'm trying.
You are.
I have it's been impressed upon me that any sort of sneaky behavior is going to, in whatever capacity, to be honest, is going to lead me probably back to addictive behavior, which I guess the two coincide, which could lead me back to drinking, which could destroy my life again. So being up to date with my doctor and having her say, yes, this is healthy, this is appropriate, means a lot to me.
Yeah, good.
Yeah,
of course. I'm happy to be a partner in your health.
Yes, me too.
You know, and that's what
awesome.
that's what it's about. Like us coming together, you letting me know what your goals are and what your priorities are, and like you said today, like, hey, I'd really like to do the PPI for a couple more weeks. Like, what do you think about that?
Yeah.
You know, and then we can have an honest conversation about what the risks and benefits really are.
Sure.
And come to the best decision for you.
Cool.
Yeah.
Well, thank you.
Yeah, you're welcome.
Yeah, very much appreciate it. Thank you so much, guys, for checking out this video. Big shout out to Dr. Moehle for being willing to be on camera to discuss my blood work and my personal medical needs. If you guys ever want to talk with me one-on-one, I can hold space with you, brainstorm with you, and certainly listen to whatever you're going through. First link in the description is my Set More scheduling calendar. I'd love to chat with you, and it helps support the channel. I also have links for at-home blood work kits if you guys are interested in finding out what your testosterone levels are. I think this information is valuable. I don't think you have to necessarily do anything in particular about the info unless it's egregious, but knowing is important. We live in a weird time when it comes to the things that are stacked against men and women when it comes to healthy hormone profile. Things like the food we eat, the quality thereof, the air quality. Most people have sedentary lifestyles, exposure to artificial light as opposed to natural light, and a lot of other things. So I think knowing is important. I know that my life would have been very different, if not short-lived, if I hadn't discovered that I had low T. It was a huge, huge piece for me, and I don't take it for granted, and I'm very grateful. As someone who has overcome clinical depression, anxiety, depersonalization, and all of the really, really scary things that go along with dealing with mental health and physical disorders like that, I sit before you very much aware that being here is a byproduct of a great many things, one of which, though, is addressing a hormone issue that I don't believe naturally was going to be something I could overcome. So I share this all with you with great humility. Thank you for letting me share some of my story with you. Everyone's different. Everyone has different needs and wants and experiences. And I just hope you find whatever you're looking for to help you feel better. And I'll continue to do my best to be transparent and share my story as it unfolds. All right, guys, I'll see you guys in the next video. Adios.